Hello everyone. Today we will discuss occult blood test in stool examination. Bleeding into the gastrointestinal tract may be profuse with the vomiting of blood, called as hematemesis, or passage of blood through the rectum, called as melena. The bleeding is chronic with only small amounts of blood being passed in the feces. The blood or its breakdown products are not recognized in the feces. The fecal occult blood test (FOBT) fecal occult blood test is a lab test used to check stool or feces samples for hidden blood or blood products that may arise due to small amount of bleeding in the gastrointestinal tract. Fecal occult blood is blood in feces that cannot be seen in stool or on toilet paper by yourself. Usually we require approximately 200 cc of blood to be able to visually recognize the bleeding. Using FOBT, that is fecal occult blood test, we can detect bleeding that is as little as 10 cc of blood in the stool. Occult blood in the stool indicates gastrointestinal bleeding that may be because of helminth infestation or hookworm infection. Other conditions associated with internal gastrointestinal bleeding are esophagitis, that is inflammation of esophagus, often associated with acid reflux, esophageal cancer, gastritis, stomach ulcer or cancer, arterious venous malformations, colon polyps, colon cancers, diverticulosis, ulcerative colitis, hemorrhoids. Uses of occult blood testing. Requests for occult blood testing are usually made to investigate the cause of iron deficiency, anemia, or to assist in the diagnosis of bleeding lesions of the gastrointestinal tract like peptic ulcer disease, carcinoma, or diverticulosis. Testing methods. Chemically using a laboratory reagents, aminophenazone test. Immunologically using ready-made reagents in the kit tests, which are more expensive and usually less stable than the aminophenazone test. Now coming to aminophenazone test. This test detects the presence of hemoglobin in a test sample. Hemoglobin and its derivatives catalyze the transfer of oxygen from hydrogen peroxide to aminophenazone. Oxidation of the aminophenazone produces a blue color which is called as positive occult blood test. Reagents required are acetic acid 10% volume by volume percent, alcohol 95% volume by volume, hydrogen peroxide 10 volumes solution. Preparation of the working aminophenazone reagent. The amounts given are sufficient for one test with positive and negative controls. Prepare fresh acetic acid 10% volume by volume is taken as 1 ml, 15 ml of the 95% volume by volume alcohol and 0.4 grams of 4-aminophenazone or 4-amino antipyrine. Dissolve the aminophenazone in the alcohol solution and immediately before use add the acetic acid. Mix well. Preparing for the test. Any source of blood will give you a positive test. Blood from another source like bleeding hemorrhoids or menstrual period will interfere with this test. Do not eat red meat before testing for occult blood test. Red meat in the diet can give false positive test result. Do not eat cantaloupe, fish, uncooked broccoli, turnip, radish, horseradish for 3 days before the test. Patient should eat plenty of vegetables, corn and non-citrus food. Any fruit juices containing ascorbic acid, iron, barium sulfate, cimetidine also has to be avoided 2 to 3 days before the testing. Avoid drugs like aspirin, anti-inflammatory drugs, of medicines for the 3 days before the test. Taking vitamin C supplements may give false negative results. It is recommended not to take vitamin C supplements for the 3 days before the test. Procedure of the occult blood test or chemical method. Dispense about 7 ml of distilled water into a wide bore test tube. Add a sample of feces about 10 to 15 mm in diameter. Using a glass or plastic rod, emulsify the feces in the water. Allow the fecal particle to settle or centrifuge the emulsified specimen. Take 3 completely clean tubes. Label them as patient test T, negative control, positive control P. In the test 5 ml supernatant fluid from emulsified feces. In the negative control N 5 ml distilled water, and in the positive control 5 ml distilled water in which about 50 microliters of whole blood has been mixed. Layer 5 ml of working aminophenazone reagent on top of the fluid in each tube, that is pipette down the side of each tube. Do not mix it. Add 10 drops of 10 volumes hydrogen peroxide solution. Do not mix. Allow to stand for 1 minute. Look for the appearance of the blue color where the aminophenazone reagent meets the sample or control solution. If there is no change in color, then it is negative test. Pale blue, it is positive 1 plus. Dark blue, positive 2 plus. Blue to black, positive 3 plus. The negative control, this should has no color change, and positive control should show a positive reaction. Interpretation of results and sources of errors. A positive result means that the test has detected blood. This does not mean you have tested positive for cancer or any other illness. It's just an indication of internal bleeding which will require a formal evaluation of the patient's gastrointestinal tract. Physician may request colonoscopy or endoscopy to examine the entire lining of the gastrointestinal tract. The commonest causes of positive occult blood test in tropical and other developing countries is hookworm infestation, peptic ulcer. Many other causes as mentioned. False positive result. A false positive reaction may occur if the feces contain peroxidase like substances. Such reactions may be avoided by dietary restrictions. Further testing and examination should be performed by the physician to determine the exact cause and source of the occult blood in the stool. A false negative reaction may be obtained if the feces contain a high concentration of ascorbic acid. If the test is negative but there is highly clinical suspicion, two further specimens should be tested to detect bleeding, which may be intermittent.